When Bobby was 2 months old, we noticed that he started really only looking to the left with his eyes. And I called Dr. Dwelly's office to make an appointment. And I was a little bit embarrassed to be calling and saying that my baby looks to the left. It didn't really sound like a significant medical issue.
So on Bobby's exam, he was unable to track an object from the left side to the right. It's very common for babies this age to cross their eyes frequently, and that's a common vision concern for the first 4 months of life. But to have a fixed gaze to one side is very abnormal.
Dr. Dwelly was extremely attentive. He was able to video conference with one of his associates who specializes in neurology and tell us right away that there was definitely something going on internally inside Bobby's head that needed to be addressed immediately.
Dr. Dwelly told me that we needed to get in the car and drive to Stanford.
I really wanted to make the impact that this was important and really couldn't wait.
It was a pretty big ordeal just to drop everything and drive an hour and a half north.
You know, as parents, we were terrified, have this tiny little 2-month-old, but to see that the staff was waiting for us was really reassuring. They did an emergency MRI and found that he had a large arachnoid cyst in the middle of his brain. As we were preparing for surgery, the neurosurgeon, he made it very clear that if Bobby hadn't gotten there that day, that week, he probably would have gone blind first because the cyst was compressing his pituitary gland, which would have caused respiratory failure. When we were released, you know, we had gone from obviously round-the-clock intensive care to being home with a 2-month-old with some very serious medical conditions that needed sort of constant follow-up. So it was very reassuring to be able to see Dr. Dwelly every day.
The biggest benefit of having a Stanford Children's Health Clinic here in Monterey is to really provide a much higher level of care to our patients. It allows the specialty care from Stanford to reach much further into the community.
We had very comprehensive care, which was really nice. I didn't have to worry about whether the ophthalmologist and the neurologist and the neurosurgeon and all of these different teams of doctors were all, you know, wonderfully tied together through a system that ensured that all of Bobby's information was being shared, and it allowed us to have one point of contact.
It's just an incredible relief to know that our doctor is connected through the Stanford network to the Lucille Packard Children's Hospital all the way up in Palo Alto.
With the emergence of Stanford Children's Health Network here in Monterey, I feel like we've been able to provide access to world-class care in our little community of Monterey.
Bobby is, he's 2 years old now, and he's so active.
I see him annually for his physicals, and he is a healthy, happy, vigorous child in the office. He looks everywhere, sees everything as an observant little 2-year-old would.
He's made a full recovery. I mean, it's really just like a dream come true.
He's just a loving and happy little boy.